Dear colleagues, scientists, researchers, and potential delegates, I am very delighted to welcome you to Abuja. Abuja has now been selected to host the Spark International Translational Research Conference coming up in February of 2026. This global platform will convene a number of stakeholders, visionary thinkers, innovators, researchers, and policymakers who are committed to transforming knowledge into practical solutions and interventions, turning research into impact and shaping the Africa that we aspire to build. Under the leadership of President Bola Ahmed Tinubu, Nigeria has focused quite a bit on innovation, particularly in the healthcare space. One of the pillars of the health sector blueprint is the value chain, really enabling the value chain in healthcare. And that really pulls from innovative approaches to improve our supply chain. Supply chain in terms of commodities, supply chain in terms of logistics and distribution, local manufacturing as well. On the national primary healthcare development side of things, we have also embarked on bold reforms, many of which involve doing things in a new way. Our PHC revitalization has seen over 2,100 facilities newly improved to what we call level 2, which have the infrastructure, the workforce, the equipment, and the commodities across the country. On the basic healthcare provision fund, in addition to having disbursed over 52 billion naira over the last couple of years to 8,000 plus health facilities, we are now also putting in innovative approaches to ensure effectiveness of that spend, to make sure that the money gets to the facilities and it goes to pay for the services that are most needed. We are expanding the number of facilities that are receiving the funds. We are also increasing the amount that each facility gets to be closer to what they need. We are training healthcare workers, over 70,000 trained towards President Tinubu's target of 120,000 frontline health workers trained by 2027. In fact, we have now digitized those e-learning mechanisms. We also have the maternal and newborn mortality reduction innovation initiative. Now that's called NAMI. And what that seeks to do is to identify and follow pregnant women through their pregnancies and make sure they have access to the services that will keep them alive. Over 1.2 million pregnant women have been reached, over 430,000 or thereabouts are being actively followed up. On immunization program, we're innovating to really drive down the variant poliovirus through the last mile that we're in. We're expanding routine immunization. We're doing campaigns to reach our population with measles, rubella vaccines, with HPV and other new interventions. At the heart of all of these activities of the government is a desire to expand access in an equitable way to Nigerians, regardless of where they are and who they are. Now, in the context of dwindling resources, tight fiscal position globally, global aid landscape shifting, there's a need to drive to efficiency and effectiveness. And translational research is at the heart of this. New tools, new ways of doing things will be very critical to enabling us to achieve the objective of universal access within the constraints of limited resources. So investing in translational research means investing in our future. It safeguards public health, it creates employment, it stimulates innovation, protects Africa and the world from future pandemics. I therefore urge colleagues and partners to engage actively with the Nigerian Institute for Pharmaceutical Research and Development, NIPRD, and I do congratulate NIPRD for convening this incredible platform. Distinguished colleagues, this initiative is not for Nigeria alone. It is for Africa and the global community. Science knows no borders, and neither do diseases and epidemics. As we welcome the world to Abuja, our goals are very clear. We'd like to establish Spark centers in universities, research institutes, and health facilities. We'd like to have trained scientists and healthcare providers who are competent in translational research techniques for primary care. We would like to develop frameworks for knowledge sharing, innovation and policy reform, and we would like to strengthen partnerships for job creation and technology transfer. Together, let us bridge the gap between discovery and delivery. Let us improve health. Let us strengthen economies. Let us secure a sustainable and safe future for us and for our children. Thank you and God bless.
Thank you for watching. For regular updates in the health sector and female research and development, click on the subscribe button right now. Remember to like and share as well.